Hi, Dr. Ahmed with the Brain and Spine Institute. In this video, we're going to talk about an OptiLIF. Now, please keep in mind that this video is meant for the patients being treated at this practice, and that this video provides a generalization. Each patient's outcome and experience may vary. An OptiLIF is a minimally invasive fusion. In this spine model, you can see the OptiLIF consists of a mesh bag of bone that acts like a spacer, and that is placed in between the vertebrae where the disc was. In addition to that, you have rods and screws that provide stability to the spine. This is one of the most minimally invasive fusion options out on the market. I was the first spine surgeon to perform this surgery in the San Antonio and surrounding area, and as of today, I've performed more of these than anyone. This is how it's performed. With an OptiLIF, there are 3 incisions that you need to perform the surgery. There are 2 small incisions in the back where the rods and screws are placed, and you also have 1 tiny stab incision on either the left or right hand side depending on where the symptoms are. Through that tiny incision off to the side of the spine, a tube is placed into the disc space. Now you can see that when the tube is inserted into the disc, there are several nerves in the area that you have to watch out for. Neuromonitoring techniques are used to ensure that there is no nerve injury. Once the tube is inserted into the disc, there are numerous instruments used to get the disc out in its entirety. Once the disc is out in its entirety, a mesh bag is placed in between the vertebrae and filled with bone product, and this acts like a cage similar to other fusions. This part of the fusion supports the spine, and it is this part of the spine model right here. After that bone product is placed in between the vertebrae, through those 2 other small incisions, rods and screws are placed through the spine, and this completes your fusion. In an experienced surgeon's hands, the surgery can be completed in about 90 minutes. Patients usually go home day 1 after surgery. Patients will wear a back brace after surgery when they're up and about walking around. Ultimately, you'll come back to the office at 2 weeks and I'll check your incision, and then we start physical therapy. Physical therapy will continue for about 2 to 3 months. Patients are usually cleared to start driving anywhere from 2 to 4 weeks after surgery, and the same goes for work.